What's up, everybody? It's Dr. Josh Funk here, joined by Dr. Zach Baker. We are here at our Mount Airy location, and welcome to Thursday's R2P Live, where today, R2P Connect, we're here with an Ask Dr. Zach Baker Anything. We're trying to keep it appropriate and obviously related to the topic of sports, rehab, fitness, things that are related to certain time periods of the year. And today's theme is going to be centered around fall sports. So, Zach, our first question, and we get this one often, even especially from people online, not just in person in the offices, but fall sports are right around the corner. A lot of athletes potentially have had something happen to them either in spring or winter sports, potentially a surgery. How do they know that they would be ready to participate in fall sports, which for many athletes, especially at the high school level, is right around mid-August?
Yeah, it's crazy. And I think you kind of alluded to it. We need to appreciate when fall sports actually start. And I think it sneaks up on a lot of our athletes where they get halfway through the summer and they realize my preseason starts in 2 or 3 weeks. So making sure that we've got some level of consistency with training when that spring sports season ends, when you transition into summer, have we maintained a level of physical readiness and preparedness with that? And what does that look like? Are you doing it on your own? Are you doing it at the guidance of your own team? Or do you have an outside person taking care of this? So as we start to approach fall, a lot of athletes have some sort of conditioning test that they're getting ready for. So that's an easy barometer of, as you are prepping for that test or as you're doing variations of that test, how are you performing? Do you feel good? Do you look good? Are you moving well when you're doing that test? From a skill standpoint, I think oftentimes we put a lot of emphasis over the summer, almost too much, on trying to do sport-specific activity when we really just need to focus on getting healthy and getting back into shape for when the fall season starts. And I have a kid from Cornell right now who's getting ready to go back up and play soccer. And I had a conversation with him. You've been playing soccer for 18 or 19 years at this point. I don't have any lack of trust in you being able to remember how to kick a soccer ball. I'm more concerned about how is your knee going to feel that you've been struggling with pain since February and March. So I think in a lot of these instances, we go back to the basics. We make sure that we're feeling well, we're getting adequate recovery, we're getting adequate rest. We take training back a little bit more general, and we focus on just getting cardiovascular fitness up, general strength up, and then we start transitioning into our more sport-specific movement patterns and energy system development, which really means you start making your workouts look a little bit more like what you're doing on the field.
Yeah, and I think just to summarize that a little bit, my thoughts here, and you have general physical preparation, you've got more sport-specific preparation, and making sure that in a situation where we do have a clearly defined deadline, that we've been doing things to gradually build up our ability level. If we've been doing that on our own, I think it's really tough to do it on your own. Hopefully you have people in your corner that are working with you, whether or not it's a physical therapist like Zach. There's tons of really good sports trainers around. And then in situations where maybe you're working with a skills trainer, just making sure that everybody is on the same page. Potentially having them have a conversation to better provide you with information as to your overall level of readiness. I definitely wouldn't try to make that decision on your own. As we talk about individuals who maybe are coming off an injury, trying to develop confidence in a practice environment, they have been doing things in the gym, they've been doing things with a PT, they've been doing some of the skills work on their own. What are ways that athletes and potentially the coaches that are working with them can look at aspects of practice to try to reintroduce it in chunks? We're not going from doing nothing as it relates to practice, especially coming off an injury and jumping right back into 2-hour practice. What are some things that you're thinking about? What are conversations that you're having with athletes and coaches as it relates to building confidence through an efficient reintroduction of practice?
3 big things come to mind. One comes to mind is, what are you actually doing in practice? And that's the difference between, am I participating in warm-ups? Am I participating in independent, fundamental, skill-based drills? Am I doing some of our short-sighted games or competitions? Or are we going full live scrimmaging? And that's a huge spectrum that we don't need to introduce all at once. So I think early on, even if you're not cleared to be scrimmaging and going live at practice with full contact or full field, there's no reason why we can't be participating at the beginning and end of practice with warm-ups and conditioning. Then we can start to integrate some of our individual fundamental skill-based work, whether that's soccer, whether that's lacrosse, whether that's basketball. I think about getting a stick in your hand, getting a ball in your hand or on your feet, and getting some individual reps in. Very structured, non-contact, non-competitive. Then you start introducing more of your, think about like your 2, 3, 4 person drills. You're reacting off one another. It's still relatively scripted, but there's some dynamic play. And then you eventually start introducing contact and you introduce full-sided games. Now, different injuries lend themselves to different progressions. That progression we just talked about for somebody coming off of maybe a pulled muscle or a tendonitis, that could happen over the course of a few sessions or a course of a week. Somebody coming off of a big time loss injury, a broken bone, an ACL, a rotator cuff, or a labrum repair, where they haven't been participating for 5, 6, 7, 8 months, that progression may take place over 2 or 3 months. So the sequence of events looks very similar, but the timeframes look different. Now, the other 2 things that I think are the most overlooked part of return to practice is the frequency at which we're participating and the overall duration. And there's a big difference between rehabbing twice a week or working with your strength conditioning coach 3 times a week and trying to practice 5 days a week and squeezing in 2 or 3 games during that week as well. So I think oftentimes we're physically able to do everything that we want at practice, even scrimmaging and playing games, but we still haven't built up enough tolerance to the volume of what we're asking to do that to be a full participant at a high school and especially at a collegiate level when you go through a 2-3 hour practice, maybe you have an hour workout, and then you got to wake up the next day and be ready to do that again. When for the preceding 6 months, we always had 24, 48 hours in between to rest and recover. And that's where I think people start running into those secondary issues, whether it's just the minor aches and pains, not only at the injury site, but other areas of the body as well.
Yeah, and on that note, like no matter what you're doing from a conditioning standpoint, you will never be able to mimic practice in games. And if you have not been doing things through the course of the summer, reconditioning, or just keeping up with your conditioning routine, you're definitely going to be in for a rude awakening. So that's definitely something to keep in mind, Zach. I appreciate you breaking out the return to practice recommendations. I think it's incredibly important for everybody. Again, trying not to accomplish this on your own, working with professionals that can take you through a step-by-step process that is individualized for you. Youth football is something in our area that is very, very big. The kids are starting workouts already. They actually will be in pads sooner than the high school kids. What are just some things top of mind that you're thinking of when it comes to keeping youth athletes healthy in a sport like football, where naturally there's a lot more narratives surrounding injuries?
So I think you had mentioned youth athletes are already getting back onto the football field. And it's funny, I was driving by Myeski Park, which is where the Winfield Cavs play near South Carroll, and they were up there last week. Now, one thing that I think they've done a really good job with, and I've talked to other people in Frederick and Montgomery County, and they've done it as well, is getting the kids together informally throughout the summer to get them comfortable with the time of day that they're going to be practicing, the duration that they're going to be practicing, and honestly, at that age, just getting them to interact with each other and interact with adults in a relatively structured standpoint for an hour or 2 hours, and doing that in advance in a very low-risk environment. The kids get familiar with how long things are going to be. They get familiar with being tired. They get familiar with being in the heat, but there's no pads. It's very low risk. It's a very kind of open, fun, and engaging environment with, at that level, you have to keep it that way or the roster is going to look drastically different. Outside of that, I think you take care of the basics. You make sure you're eating, you make sure you're getting fluids in, not just 5 minutes before practice, but on a regular routine leading up to it. We're getting quality sleep. And then the thing that I honestly made this mistake with my own kids, not for football, but for lacrosse the other year. If you've got a 6 p.m. practice, be mindful of what you're doing in the 8 hours leading up to it. Don't have your kid at the pool for 5 hours. Don't have them at a camp for 4 hours in the morning leading up to it. and just make sure that you're putting your own kids in a position for success. And I think that's what we can do as parents, as families who are getting involved. From a coaching standpoint, I think the best thing that you can do is set expectations. Make expectations clear for the parents as to what they can expect their kids to be doing at practice. And that can be as simple as, hey, tonight's a walkthrough, or tonight we're going full pads, or tonight we're going to be doing contact, or it's going to be introduction of a playbook, or more skills, or chalkboard type stuff. So I think just having people knowing what they're going into puts everybody in a better situation to be able to mentally and physically prepare for it as well. It sounds basic, but I've been a part of a lot of different teams as a player and as a parent, and there's definitely some people who do a really good job of that, and some people who leave things a little bit open to interpretation. And I'd say the more enjoyable experiences I've had as a parent, and the ones that I've also seen be successful, are the ones that are setting the tone early and they're getting those conversations out of the way.
You talk a little bit about your role as a parent. You talk about your structure for your kids. Your two oldest just wrapped up summer club sports. Obviously, the fall is right around the corner. We're already talking about fall sports. For individuals whom have club sports on top of potentially rec and or high school sports, sometimes there's very, very limited windows where they get to kind of relax and unwind and quote unquote be a kid. What are some things that you're constantly thinking about as it relates to the change of seasons, change of sports, and making the most of times where your kids don't have as much structure?
It's tough. It's the balancing act as a parent where you know what you want to do, but then you also got to keep your own emotions and your own ego in check. You always want your kid to do well. You want them to be successful, which admittedly, it puts pressure on you wanting to spend time outside of practice doing stuff with them, which isn't a bad thing, but we need to make sure that we're putting the kid first. Is this something the kid wants to do? If you want to go out and play catch, or you want to go out and do stuff in the yard or connect with other teammates to get extra reps in, that's great. Make sure it's not forced, because it doesn't matter how good your kid is at a sport if they don't want to play and they quit the next year. So I think just making sure that you're always having open conversations with your children, making sure that what they are signed up for is what they want to be involved in. There's a big jump from rec to club, and there's a lot of pros and advantages to being in rec sports, and there's a lot of pros and advantages of being in club sports. You need to make sure that what you are looking for as a family and as an athlete matches up with what either that rec or club program provides. And then after that, we just wrapped up club lacrosse. We had informal workouts in the winter. You have your spring season, then you have your summer tournament season. We wrapped up the end of June. We just had the month of July where we also had our tryouts for this upcoming year. The big thing that we try to do with our kids is keep them active, but in different ways. So our kids are on swim team. Our kids are athletic. They're not great swimmers. So when you compare them to other swimmers, so it's fun. We show up, we get them in the pool, they get to compete, they get to have fun, they get to be physically active, but they're in a completely different environment. They're not on turf, they're not on grass, so they're getting different stresses to their body. They're staying in shape. They still have the routine of going to practice on a weekly basis, but it's not the exact same monotony of what they just spent the previous 3 or 4 months on. And they're around other kids too. So I think we're fortunate enough where the field hockey and lacrosse teams that our daughters play on, they provide opportunities to be active and involved on a year-round basis, but they're very clear cut on, hey, this is the time of year that we expect you to be with us. We expect you to be, this sport is the priority. In these other times of the year, we have the opportunity to get together. But if you play soccer and it's not lacrosse season, go to soccer practice. If you play field hockey and it's not lacrosse season, go to that field hockey tournament instead of this optional skills work. So I think, honestly, one thing we do is we have a big master calendar. And when I say we, my wife creates a big master calendar of when and where everything is. And then we tell the kids, hey, this is what season we're in. This is what we have. We also have this, this, and this available. Do you want to do it this week, or how should we approach it? And it's not perfect. I don't think there's an exact science to go about it, but keep it fun. Make sure the program you're in matches up with what you're looking for, and make sure that what you're trying to do from a physical standpoint isn't competing with them just being healthy in general or enjoying their sport.
I'll add another really good resource is to learn about the long-term athlete development model, the LTAD. It really helps parents, coaches put things into perspective as to things that they should be emphasizing with your young people at various ages, and also related to peak height velocity, which is the growth spurt. But thanks everybody for tuning in. This will be a weekly thing moving forward. So if you have questions, you want to get in touch with the physical therapist and chief clinical officer at Rehab to Perform, Dr. Zach Baker, feel free to send questions, add comments to the video. We'd love to make sure that we're addressing your questions, but hope everybody has a great week, and we'll be in front of you soon.
Let's ask if you still want to end the session.